Dr. Adam Dawud is a consultant epidemiologist with WHO. He sheds light on arthritis and how to manage the condition.
Arthritis, as the name implies, is the inflammation of the joints. The joints in our body tend to have some inflammatory response. And when that happens, it is characterized by some pains, stiffness, immobility, and sometimes deformity. And the risk factors that cause arthritis are numerous. However, age is one of the risk factors. So people that have attained 40 years and more tend to face more problems of their joints or with their joints, so that inflammation of the joints is seen. Another important factor that nobody has control is genetic. Some people can inherit arthritis based on their genetic makeup. So if their parents have it, it can be transferred to them. It has a lot of consequences in daily life because it presents with pains. So you see, if you are faced with pains, you will find it difficult to actually continue to do one or two things that you can freely do before without the pains. And the arthritis itself can lead to what? Immobility. You will not be able to move or utilize the joint that is affected. Due to our poor health care system, arthritis is a great public health concern because most of the people present only when they have pains. They will be managing it until when pain is evident that they will now come to say they are seeking for one or two assistance. By so doing, you realize that it might be late. If you have been diagnosed with arthritis and you want to live a normal life, as I have said earlier, you have to comply with your drug treatment. You have to continue to avoid the sedentary lifestyle. So you must try as much as possible between 2 to 3 days in a week. You go out for 1 or 2 exercises that will actually mobilize yourself. And sometimes when the deformity is already trying to ensue, we advise the patient we link the patient up with physiotherapists so that they will actually try to make effective movement of the joint. And by so doing, they tend to do better.